Well, welcome. This is our continuing series in getting to know our faculty, and we're really lucky to be talking today with Ugwuji Maduekwe. Ugwuji, thanks so much for joining us. Thanks so much for coming to MCW.
Thank you for having me in multiple ways.
Yeah, and maybe we can start by tell us a little bit about where you grew up and how you ended up in medicine and why not maybe CEO of ExxonMobil or something like that.
Well, I grew up in Nigeria. I moved to the U.S. to a small town in Texas called Tyler, Texas when I was 15. And that's when I decided to go into medicine sometime around there. I went to University of Texas at Dallas. And I liked medicine because I wanted to make a difference in people's lives. My father was very much involved in public service. And so there was always this expectation of whatever you did, it was going to be involved in some way in helping people's lives be better.
Oh,
and as someone from the Niger Delta, ExxonMobil was not high on my list.
There you go. I probably shouldn't have used that analogy.
Was not high on my list of
yeah.
Things that would make the world better, I would say.
Yeah.
Yeah.
Now, how'd you end up in Tyler, Texas, having lived in Houston for a very long time?
Yeah.
I haven't been to Tyler, but I certainly had many patients from that area.
The Rose Capital. It was just serendipity. We came here because there were political issues in Nigeria. My dad was a politician on the wrong side at that time. So we came out for a quick escape. And then when things calmed down and people were going back, my dad's first cousin lived in Tyler, Texas.
Oh, wow.
And so
Yeah.
I went to live with her.
Oh, that's great.
That's how I ended up there. Yeah.
And so from college to where was medical school?
Medical school was in Boston at Harvard Medical School.
And how did you like Harvard Medical School?
I loved it. I was in a special program they have there. Yes, there's a higher level of nerd than a Harvard Medical student. And it is the HST Harvard Medical student. So we were Harvard Medical students and MIT grad students.
Oh, wow.
So it's a special program they have there, and I did that, and it was great because we got to be the usual medical student component, but we also interacted with their version of biomedical engineers, medical physicists. We're all in class together. So in the first 2 years, half our classes were at Harvard Medical School, and then half our classes were at MIT. So you really got a mix of both places. Yeah. So I loved it.
And what stimulated you to think about surgery as a career?
Funnily enough, I started out med school and I wanted to be a pediatric hematology oncologist. I sometime in college fell in love with the cancer as like a thing to study, and I was also sort of minoring in literature, and I thought cancer was like the body betraying itself. So 19-year-old Ugwuji was like, that's what I'm going to do. And when I started medical school, I said, the two things that are not on the table are surgery and psychiatry. And the first week, Judah Folkman came and gave a talk to our med school class.
The father of angiogenesis.
The father of angiogenesis. And I'd already said I was going to do pediatric hematology oncology. And so he's showing us, giving us the lecture and telling us about his arc and the many years he spent being sort of ridiculed about his research and how it had just come to pass. And he was showing us these tumors in these little children that he was excising. And I was like, the pediatric oncologists aren't the ones completely fixing the problem and having a hands-on approach. So I started thinking about surgery then. And then my mentor that I was assigned to in HST was Patricia Donahoe, a renowned pediatric surgeon.
Absolutely.
So I was kind of set up to fall in love with surgery. So I fought with myself and changed my mind.
And you stayed there for your residency?
I stayed at Mass General for my residency, yes.
Yeah. And then what stimulated you during residency to think about oncology? Was it Judah Folkman and I think that he did something with the retina of mice or something.
Mm-hmm.
Wasn't that his model?
That was part of his model. I always stuck with the oncology. I always have been interested in cancer. And I think in undergrad, there was a particular class we took that was about viral oncogenes that I thought was just really fascinating. And after that, so it was always going to be oncology. And after that, the question was whether it was going to be pediatric oncology or adult oncology for me. I never wavered. I was seduced for a minute by thoracic surgery because it's basically oncology in the chest. But no, it was always oncology for me.
Wow.
Yeah.
And so where did the world lead you after your surgery training at MGH?
So surgery training at MGH, and then I went to University of Pittsburgh for my complex general surgical oncology fellowship, and which was really great. And the folks at Pittsburgh.
So it was already ACGME approved by the time you.
By the time I finished.
Okay.
So I was the first class that had to take the boards, and had Dr. Evans.
I asked you a couple questions.
They were
probably the easiest questions in the entire world. They were.
Dr. Evans and Dr. Selwyn Vickers were my pancreas room.
I was the easy
I will
questioner.
never
He
forget.
was the hard examiner in that room.
I will never forget. So I was the first cohort.
Wow. So what number do you have?
8.
Oh, that is just so great. That is so great. And you could have got, it's just the luck of the draw that you didn't have number 1, right?
I don't know how they do it.
Yeah.
It's not alphabetical. U and M don't tend to be at the beginning, so I have no idea.
Oh, wow.
But
that still is pretty neat.
Yeah, it's very cool. So I was in the first, so we were not ACGME approved at the beginning, but we were ACGME approved by the end.
Yeah.
And Pittsburgh was really great because I went there and came out sort of with specialties in 2 things that I had never done in residency at all. So HIPEC and robotic surgery, which 2 things when I was leaving Mass General, my attendings were like, they do some weird stuff at Pittsburgh, but don't worry, we trained you properly.
both so important.
And both very important.
Yeah.
So it was a really great experience there.
And when you finished your fellowship, you actually wanted to come to Milwaukee, but something happened. There
were a few detours. There were some few detours along the way. You didn't have room for me yet. You weren't ready. So I still, with the public service thing, I really wanted to practice in a place that was focused on working with the kind of people that I hadn't seen in practice. So at MGH at Pittsburgh, the patient population was not very diverse. So my first job was at a safety net health system in Boston, Cambridge Health Alliance. Yeah. And so I started out there, and then I went on to Bay State in Western Massachusetts, where I got to see geographic disparities in surgery because I was stunned to see what people would show up with that in the western part of Massachusetts, right, that we would never see in Boston. And then from there, I finally figured myself out. My father passed away very suddenly, and that was a big shift for me in sort of figuring out what he'd always said about public service. And so I decided I wanted to really focus on disparities in surgical oncology because we do a lot of really, really cool stuff. We do a lot of really interesting surgery. And it was dawning on me that not everyone got to experience the cool robotic surgery that we were doing, the extensive pancreatic resections, the HIPECs. And there are disparities in who gets to avail themselves of these innovations. And so I wanted to get a master's in public health, and then a job opened up at UNC where, I mean, some people say it's the best school of public health in the country. Wow. I wouldn't say it, but I think that that's universally acknowledged. So I went there and was on faculty there, and also started their peritoneal surface malignancy program, their HIPEC program there. And then was doing great, got my MPH. And then I was, finally, Wisconsin was ready for me.
There you go. Absolutely. Absolutely. It took us a long time.
It's a little bit of time.
So 2 remaining questions. So tell us a little bit about your role here at MCW in advancing a healthier Wisconsin. And then secondly, what you like to do outside of work.
Okay. So here at MCW, I am Director of Regional Therapies. Clinically, and focused on expanding our peritoneal surface malignancy program as well as our liver perfusion program. I'm also Deputy Director of Advancing a Healthier Wisconsin Endowment, which is a health philanthropy based out of MCW. And so our focus there is great. It's very simple. It's to make Wisconsin the healthiest state in the nation. And so my role there is to be sort of a thought partner to our director, Jesse Ehrenfeld, and to focus on health equity across the state. So it's interesting
great.
for me because the work that I was doing in disparities, here's an opportunity to really apply that across an entire
Absolutely.
population.
Yeah.
What do I do for fun? I have become very boring. I am a member of the Pello cult, as I call it. That's the Peloton cult.
Okay. Okay.
I
So that's the bike?
the bike, yes.
Or you can be a Peloton cult with any Peloton equipment or just the bike?
It's any Peloton equipment or things, but it's really the bike.
Okay.
It's about the
Okay.
bike and the instructors.
Yeah.
Other people like the tread. I don't understand that. The bike is the best. And then I also read a lot. So I'm a voracious reader. Been a little busy right now, but I read a lot. Those are my two main things. And then I used to love to travel before.
Yeah. Well, the world will get going again. It'll get
Here's
going
hoping. I need to go to Paris sometime soon.
Yeah.
That was my trip in March of 2020 that got canceled.
Well, it's still there. It'll be there. Well, Ugwuji Maduekwe, thank you so much.
Thank you very much,
this was
Dr.
just
Evans.
perfect, and really thanks.
Thank you.